Welcome to this Royal College of Surgeons of Edinburgh webinar. This is Stefano Del Monte. I am a specialist in prosthodontics, and today we are going to talk about mandibular movements. From a mechanical point of view, our mandible is capable of two basic movements, translation and rotation. We have a translatory motion when all points within a body, represented by the white circles in the blue square, have identical motion. For example, if a body moves back and forth or up and down. We have a rotary motion when a body, represented by the blue square, is turning around an axis, represented by the white dot. The mandible is capable of pure translatory motion during protrusion and retrusion, as you can see on your left-hand side. The mandible moves following a pure rotary motion while opening and closing within the terminal hinge axis, as you can see on your right-hand side. Most of the time the mandible moves following both translatory and rotary motions at the same time, as we will be seeing while describing the mandibular movements in detail. Let's start by describing the centric relation position, which is defined as a maxillomandibular relationship independent of tooth contact, which means that we could identify the centric relation on the dentate, partially dentate, and edentulous patients alike. So, the centric relation is a maxillomandibular relationship independent of tooth contact, in which the condyles articulate in the anterior superior position against the posterior slope of the articular eminence. The centric relation is so important from a clinical point of view because in this position the mandible is restricted to a purely rotary movement, which is called the pure hinge axis movement, and you can observe it in the animation. The pure hinge axis movement only occurs in the first 20 mm of incisal opening. Then, after that, the condylar head begins to move forward due to the influence of the lateral pterygoid muscle and begins translation. If the mandible closes, we are in centric relation again. Now, if the mandible slides forward from the centric relation position, it will be in the intercuspal position, which is defined as the complete intercuspation of the opposing teeth independent of condylar position. In 5–10% of the population, the centric relation and the intercuspal position are the same position, which is called centric occlusion. So, to summarize, centric relation is defined by the condylar position and is independent of teeth position. And the intercuspal position is exactly the opposite, as it is defined by the teeth position and it is independent of condylar position. If the mandible slides a bit further, it reaches the edge-to-edge position, when the incisal edge of the upper and lower incisors are in contact. Then, if the mandible moves even further, it will reach the maximum protrusion position. Then, if the mandible is opened from the maximum protrusion position, it traces an arc, as the one represented from the point 6 to point 3. The diagram traced by the mandible while moving is called Posselt envelope of motion, as it was first described by Dr. Ulf Posselt in his iconic study Studies in the Mobility of the Human Mandible, published on Acta Odontologica Scandinavica in 1952. Let's now discuss about the determinants of mandibular movements, which are the anatomic structures that dictate or limit the movements of the mandible. In other words, if the mandible moves the way it does, it's because of the determinants of mandibular movements. They are divided in posterior determinants, which are the medial wall of the glenoid fossa and the articular eminence, and the anterior one, which are our teeth, in particular the overjet and the overbite of the anterior teeth. Let's focus on the role of the posterior determinants during protrusion. On the left, you can see a drawing representing the temporomandibular joint. The protrusion of the mandible is initiated by the inferior head of the lateral pterygoid that puts the mandible forward. The condyle disc complex is then pushed against the anterior border of the glenoid fossa, the articular eminence, and because of its slope, the mandible goes forward and downward. You can see in this animation how the articular eminence, and in particular its slope, guides the mandibular movement. Here we can see how the maxillary incisors act as a determinant of mandibular movement, by limiting the movement of the lower incisors and therefore the mandible downward and forward during protrusion. So far, we have observed the movement of the mandible and its determinants from the sagittal plane only. To better understand the movements of the mandible in all three planes of the space, we shall now describe the mandibular movements in the horizontal and the frontal planes. Let's begin describing the envelope of movement in the frontal plane, starting with the mandible in the intercuspal position. The mandible then can slide right and left, tracing the maximum lateral excursive movements. The apex of the envelope corresponds to the maximum opening to the mandible, and the purple dot is the rest position of the mandible, defined as the postural position of the mandible when an individual is resting comfortably in an upright position and the associated muscles are in a state of minimal contractual activity. The determinants of occlusion during protrusion are the same one already observed from the sagittal plane, namely the articular eminence and the anterior teeth. However, only from the frontal plane we can really appreciate the importance of the maxillary incisors in the disclosure of the posterior teeth during protrusion. This kind of articulation scheme, when the relationship of the anterior teeth prevent posterior tooth contact in all eccentric mandibular movements, is called anterior protected articulation, and is represented in this video where the contact among the upper and lower central incisors prevent the contact of the posterior teeth during protrusion. Let's now describe the determinants of mandibular movement during lateral excursive movements. Some terminology first. When the mandible moves to the right condyle is called the working side condyle, and therefore the left condyle is called the non-working side condyle. And vice versa when the mandible moves to the left. The non-working side condyle moves down and medially during excursive lateral movements, while the working side condyle presents mainly a rotational motion around the sagittal axis, as you can observe in the animation. The posterior determinants of the lateral excursive movements are the medial walls of the glenoid fossa, where the non-working side condyle slides against during lateral movements, as you can observe in the animation. Let's now describe the anterior determinants during the excursive movements, which are usually the canines. As you can see in this case, the contact between the upper right tree and the lower right tree guides the right mandibular lateral movement and prevents posterior tooth contact during excursive movements. The articulation scheme, where the canine prevents the posterior tooth contact during lateral movement, is called canine guidance. The canine, however, doesn't always guide the movement of the mandible during lateral movement. As you can see in the video, there is actually no contact between the upper left tree and the lower left tree, and the lateral guidance is provided by the upper left 4 and the upper left 5 instead. In this case, we would describe this articulation scheme where more than one tooth prevents the posterior tooth contact during lateral movement as group function. Let's now describe the mandibular envelope of motion on the horizontal plane. As you can see, the envelope of motion in the horizontal plane has a rhomboid shape. We can observe the mandible moving from the centric relation to the right and to the left, and to the position of maximum protrusion, and finally to the intercuspal position, which is anterior to the centric relation. The posterior determinants during excursive movements are the medial walls of the glenoid fossa, as previously discussed. The non-working side condyle, observed on the horizontal plane, moves down and medially during excursive movements. The angle formed between the sagittal plane of the condyle, represented by the blue line, and the average path of the advancing non-working side condyle during lateral movement, represented by the green line, is called the Bennett angle, and is set on the semi-adjustable articulator at 15 degrees. The working side condyle, during excursive movements, rotates and moves distally. To make this movement more obvious, in the image you can see the position of the mandible in centric relation in white, and the position of the mandible during excursive movement in blue. The space between the two red lines represents the movement of the working side condyle during excursive movements and is called Bennett movement. Its average is 0.75 mm with a maximum of 1.5 mm and a minimum of 0 mm, which means that in some patients there is actually no detectable Bennett movement. This concluded this webinar. I hope you have enjoyed. Thank you for your attention.